Millions of people worldwide suffer from skin conditions. Medical attention is recommended, however, home remedies can be an important supplement to a doctor's care. I'm Marcy McDonald with PNW Suburban Homesteading, and today Shauna Zimmerman will demonstrate how management of eczema symptoms may be no further away than your kitchen cabinet.
Hi, I'm remote homestead accomplished Shauna Zimmerman. I'm also one of about 204 million people worldwide who suffer from a skin condition called eczema. I also had a tooth knocked out. That has nothing to do with my eczema, so please just ignore this hole in my head as best you can. Eczema is a type of dermatitis that destroys your skin's moisture barrier and causes your skin to become dry, itchy, bumpy, and rather painful. There are several types of eczema. The kind I have is called dyshydrotic eczema, which is characterized by pinhead-sized watery blisters beneath the top layer of skin, and it usually appears on the hands and feet. It looks pretty gnarly, so we'll show you some close-ups at the end of the video where you can skip them if you'd like. You know those squishy stress toys like this? Now imagine doing that with a barrel cactus. Yeah, that's what it feels like. Pretty painful. I've been fighting this since I was about 19. Now, I want to make it clear that I am not offering medical advice. I am not a doctor or a dermatologist. Unfortunately, doctors really don't know what causes eczema, and as of the year 2025, there is still not a cure. The good news is that it's not a bacterial, viral, or fungal infection, so it's not contagious. The bad news is there are almost as many triggers as there are people who suffer from it. So I can't talk about a cure, even if I was medically qualified, which I am not a doctor. Best I've got is my basic first aid certification. So I am going to talk to you about a few things that you can do to relieve the dry, itchy, painful symptoms. There are many over-the-counter products to help soothe the flare-up. Some of the recommendations from the National Eczema Association are hydrocortisone creams to soothe the rash. These are 1% hydrocortisone. Interestingly, I have found that even the ones labeled extra or maximum strength are still only 1% hydrocortisone, so always read your labels. Antihistamines can alleviate the itching. Most people are familiar with the brand name of Benadryl, but any good antihistamine that works for you will do. And soothing lotions with colloidal oatmeal. Try to avoid anything with perfumes, essential oils, or lanolin, as these can often cause or exacerbate a flare-up. Before I talk about home remedies, first let me say this. If your eczema is bad, I 100% recommend you see a doctor. There are prescription steroids and other treatments that, while they aren't a cure, can potentially manage your symptoms. And if you have a lot of skin cracking, you're opening yourself up to the possibility of an infection, and that might need an antibiotic. The first time I went to a doctor about my eczema, I think I was about 22 years old at the time. It was all over the tip of this finger. He told me that there really wasn't anything that he could do for it, and then said, quote, "But I can see you're worried about it, so I'm going to prescribe you some Valium." Don't ever let anyone treat you like this. This is a real condition, and no amount of psychotropic medication is going to clear it up. Of course you're worried that your skin is painfully blistering and cracking for no reason that you can tell. I did not take the Valium, and I went to find a doctor that would take me more seriously. But the funny thing is, stress is a major factor for eczema sufferers. So if you are feeling anxiety due to your eczema, my first home remedy is a great stress reliever. Let's go squish our hands into a bowl of cold oatmeal. A colloidal oatmeal soak is a lovely natural moisturizer. As I mentioned, eczema damages your skin's natural moisture barrier. Colloidal oatmeal creates a layer on the skin that helps retain moisture, at least temporarily. Start with plain oatmeal that has been pulsed a few times in the blender until it's a coarse powder. Doesn't matter if it's regular or instant, it just needs to be plain. No brown sugar, no peaches and cream, because we're not making peaches hand cream here. Put the oatmeal in a bowl that's big enough to soak your affected area. I've got about a half a cup of powdered oatmeal here, and I'm going to cover it with this hot water. Give it a quick stir to break up any lumps. While it's steeping for a minute, let me mention that eczema sufferers are advised to avoid hot water. Take warm showers, not hot, and try to get somebody else to do the dishes. I'm absolutely not going to stick my hands in this boiling oatmeal. Once it's steeped and the liquid has turned an opaque, milky white, I'm going to put in this thermometer and then add some water until it's body temperature or below. I find a cool soak relieves itchiness and burning better than a warm one, but they both moisturize about the same. Just adjusting the temperature here. Just a little less than 100 degrees. Now that it's cooled down and stirred up well, I'm just going to go ahead and let my hands soak for a while. Eczema sufferers need to avoid harsh scrubbing or exfoliants during a flare-up. Well, oatmeal is a very gentle exfoliant that helps remove dead skin cells, and you'll build up a lot of those during an eczema flare-up. Oatmeal also has natural compounds similar to what's found in soap. These will help remove excess dirt and oil without stripping the skin's natural oils. Oatmeal has natural phenols and vitamin E, which help reduce inflammation, and compounds called avenathramides, which soothe irritated skin. I'm told oatmeal can boost collagen production, but I don't know if that's from soaking in it or eating it. Plus, it's just squishy and fun. Now, the thing that I'm ambivalent on is that oatmeal has flavonoids which absorb UVA rays. That's great if you're concerned about premature aging, but some forms of eczema have been shown to respond to UV light therapy, so you might not want to block all of that. Your doctor or dermatologist can tell you much more about it than I can. Some people do entire tubs full of oatmeal bath if they have eczema in more places than just on their hands or feet, or if they just want the skin benefits of colloidal oatmeal. which sounds great, especially if you have a cinnamon and brown sugar candle to be burning at the same time. Just be sure to have a pool net handy to skim out all the oatmeal when you're done, and use a fine strainer over the drain so none of this gets in your plumbing. And never ever run the jets if you have a Whirlpool tub. A minute or two of oatmeal going through the pumps and you will no longer have a Whirlpool tub. Anyway, soak for no more than about 15 minutes. You may not know this, but when your fingers get all wrinkled and pruny from being in water too long, you're actually doing damage to the skin cells. Last thing you need if you've got eczema. So after about 15 minutes of soaking, wipe your hands clean, but don't wash it off if you can avoid it. Keep a good moisturizer nearby and coat your skin with it as soon as possible to seal in the benefits of the colloidal oatmeal. Some natural moisturizers you might already have in your kitchen, which are recommended by the National Eczema Association, are coconut or sunflower oil. Topical vitamin E oil is an excellent moisturizer with anti-inflammatory properties, although it makes it hard to open a doorknob when it's applied to hand eczema. Once you're done, you can save this colloidal oatmeal bath in the refrigerator and get a few days use out of it. Just warm it up to a pleasant temperature and keep using it until you don't feel like it's giving you the same moisturizing results. Otherwise, just enjoy a relaxing soak. You may not realize it, but your skin is a major component of your immune system. It acts like a barrier to physically keep bacteria out of our bodies. You'd be surprised how many microbes are on your skin, and we're talking about some pretty serious ones like staph, strep, maybe even E. coli. Unfortunately, with eczema, that barrier is compromised, and it can be painful and irritating to use antibacterial soaps and hand sanitizers during a flare-up. Human skin is naturally slightly acidic, but dermatological studies indicate that the skin experiencing an eczema flare-up turns slightly alkaline. So a simple soak that helps balance the pH of the skin and has been indicated to have antibacterial properties is to mix a tablespoon of apple cider vinegar for every cup of warm water. That means if I have 8 cups of warm water, I'm going to add half a cup of apple cider vinegar, as there are 16 tablespoons in a cup. If I was filling a whole bathtub, I would probably pour in 3 cups. Same rules about warm or cool water instead of hot water that I mentioned earlier. We're just gonna pour this in. I'm just gonna put my hands in and soak for no more than 15 minutes, and then give my hands a quick rinse, and as I mentioned before, put on a good moisturizer within 3 minutes of drying my hands off. And just to reiterate, none of this is curative. Home remedies like this are for managing the symptoms, and in this case, helping wash away the bacteria away from the affected area. If you have an actual infection, get yourself to a medical provider right away. Some people have luck with a very diluted bath of bleach instead of vinegar. In that case, use normal, unscented household bleach without any additives and mix only 1 tablespoon per gallon of water. That's no more than half a cup in a bathtub. I personally have never tried a bleach soak because, unlike vinegar, which is obviously acidic, bleach is slightly alkaline. It really wouldn't help rebalance the pH of the affected skin, but if that's what works for you, then that's what you need to do. Take care in all cases not to submerge your head or get any of this in your eyes. The science on bleach and vinegar baths with eczema is a bit inconclusive, but if you find relief in either of them, there's no harm if you limit it to 2 to 3 times a week. Sometimes an Epsom salt soak can help reduce inflammation at the site of your eczema outbreak. Epsom salt is not table salt, it's magnesium sulfate instead of the sodium chloride that we sprinkle on our French fries. It makes a good soak by dissolving 2 cups per gallon of water. There's another type of soak that I like to do, and that's salt water. Unfortunately, the current science on salt water's effectiveness on eczema is even less conclusive. On the other hand, there are a lot of products out there touting the effectiveness of Dead Sea salts or whatever on your eczema, but nothing has been definitely proven as of the year 2025. But cool salt water gives me some relief from the burning, and sometimes it helps when those little blisters that I get from my dyshydrotic eczema start to rupture and maybe ooze. Make your saline water by mixing half a teaspoon of salt for every cup of water. Plain old salt will work just fine, or sea salt or pink salt, whatever, as long as it doesn't have a lot of additives or extras, which means sorry, no garlic salt. I am a scuba diver, and I discovered salt soaks after my last few diving vacations. I realized that after a week of diving in the ocean, doing multiple dives a day, and spending up to 5 cumulative hours in the water every day, the couple of weeks following that were some of the most eczema-free times I've had in my adult life. But this is what I mean when they say the science is inconclusive. Sure, it sounds like soaking in seawater cleared up my outbreak, doesn't it? Maybe. But it could be that my eczema is triggered by some environmental factor at home or at work, and going on vacation removed me from exposure to it. Or it could be that my eczema was stress-based, and when I de-stressed by going on vacation, the eczema responded accordingly. I don't know for sure, but I will 100% use it as an excuse to schedule more scuba diving vacations. I'm going to show you how to do a wet wrap treatment for eczema. Wet wraps involve applying a damp cloth to affected areas of the skin. Because you're not completely submerging your skin in a bath or a soak, a wet wrap can be left on longer. You can even overwrap them with a dry layer to retain moisture, which can help soothe your itching and burning and give you a little more mobility around the house without trailing drips all over. Most wet wraps are done in combination with a moisturizer or steroid cream, but in this case, I'm going to make a wet wrap with chamomile tea. Chamomile, or chamomile as some people pronounce it, has natural anti-inflammatory properties. Right now, my hand eczema has inflamed the skin on my fingers so much that it's actually a little painful to make a fist. So here's how you do it. Brew a strong chamomile tea and let it cool completely. I used some dried chamomile from last year's herb garden. Be sure to wash your hands thoroughly. If you were using a moisturizer or steroid cream in this process, you would apply it now. Soak a clean cloth or gauze in the tea. Make sure the cloth is not too rough and the fiber content won't irritate your eczema further. I know that may sound strange, but I've met people who are allergic to polyester. And make sure you're not allergic to chamomile. I know people who react to that too. Wring out your towel so it's damp but not dripping. Then simply wrap the damp cloth around the affected area. Then you'll want to cover it loosely with a dry layer, like a clean cotton towel, to retain moisture. Some people with hand eczema like me will put on a cotton glove for the wet layer and then cover it with a latex glove. But I've personally discovered that gloves exacerbate my eczema. I think it's because my skin can't breathe. So you can leave this on for several hours or overnight, depending on the severity of your eczema. Chamomile tea is also reputed to have some anti-inflammatory properties if you drink it. As always, it's important to consult a doctor before trying this method, as it may not be suitable for all cases, especially if you have severe eczema or open wounds. The risk of wet wraps is that they create a moist environment that could potentially encourage bacterial growth if not used properly. So make sure to talk to your doctor, keep your skin clean, and use this method on unbroken skin no more than 2 or 3 times a week. If you do it right, I think you'll find it quite relaxing. When I have a flare-up of dyshydrotic eczema, it usually manifests in a fairly predictable course. The first stage starts with these little fluid-filled blisters under the skin. They sort of look like miniaturized tapioca pudding. The skin might feel a little tight from the pressure of the fluid, but this doesn't really hurt unless I bump it against something. Then it feels like pressing my fingers into a bowl of thumbtacks. The next stage is where the pain starts. Everything is red and inflamed. The skin gets very dry and the dead cells just pile up without shedding off, which leads to deep cracking and bleeding. Sometimes it even develops spots of hyperpigmentation. And yes, if your skin looks this bad, you really need to see a medical professional. And then comes the peeling. So many layers of dead skin come off in thick sheets that you end up with raw skin that bleeds easily. I particularly hate it when a sheet of dead skin peels off right up to the edge of the patch of eczema, and rather than detaching there, it keeps ripping into the healthy skin. Ouch. But don't think it's a 1, 2, 3 done kind of situation. No, you can have patches of eczema in different stages all at the same time. Even better, you can have more than one type of eczema. Here's a nice little patch of contact dermatitis I got from the bandage I had to wear after donating blood. At least the good news here is that as long as I carefully wash off all the adhesive, which apparently I react to, and put on a little hydrocortisone cream, this will clear up in about 24 hours. Sensitive skin is no fun, folks.
Please consult a doctor before trying any of these remedies. We are sharing this information to supplement the treatments offered by your medical practitioner, not in place of them. As a part of our homesteading philosophy, we firmly believe in science and modern medicine. However, we know that plants and home remedies from our ancestors can sometimes offer additional relief from our ailments. Eczema is a miserable condition. If we can help you ease the discomfort, then we want to be of assistance. Thanks for watching. Please like and subscribe. Until next time, be curious, keep an open mind, and never stop learning.